You may be one of the many that is thinking about quitting smoking. Since the start of the new year, many people have focused on rebooting their health goals, but quitting tobacco you can do any time of year can be the start time. Joining us now is Cody Martin, a physician assistant with Cone Health Virtual Care, to share some practical recommendations and resources to help you take that first step toward a healthier life and quitting smoking. All right, so let's kind of just start with the big picture. Let's just kind of talk about why it is so important to stop smoking or using tobacco.
Yeah, well, Tanya, thank you for having me. It is so important to stop the use of these products due to all the many health risks associated with use. And, oftentimes when people think about tobacco use and health risks, they think of lung things. So, risk of lung cancer or bronchitis or emphysema. But there are a lot of other health risks associated. Smoking is the leading cause of heart attack and heart disease. It is significantly associated with other cancers. So, like oral cancers, throat cancers, bladder, kidney cancers, even pancreatic cancers. We know that it affects hormones in the body, specifically estrogen. It can increase risk of fractures. Um, and then, even sort of surface level, thinking of our skin, it can cause early aging, fine lines and wrinkles. It can have an impact on our vision, both overall vision and night vision. So there are a lot of health risks associated, and that's why we really, advocate for people to stop use.
Yeah, much more than just lung issues, that is for sure. All those things that you mentioned. What about if there are people out there right now that are saying, you know what, I've been a smoker for decades. What is quitting now going to do for me? It's maybe too late for me to quit.
Yeah, so I always encourage patients, it's never too late to quit, right? There are a lot of, just like there are a lot of risks from use, there are a lot of benefits to quitting, and some of those are benefits that happen pretty quickly. So, we know within 20 minutes after your last use that there's a decrease in your heart rate and your blood pressure. When we look at, just a few weeks to a few months, there's improvement in circulation, there's improvement in your lung function, your heart attack risk begins to drop. So there are a lot of those benefits there. So it's never too late. Really quitting just increases that quality of life. And so, yeah, whether you've been smoking for a few weeks or several decades, it's never too late to take a step in the right direction.
You always hear people talking about how hard it is to quit smoking. So what are some things that people can do to set themselves up for success to be able to do that?
Yeah, so the biggest thing I think people can do is try to be informed. You know, doing your research, whether that is talking to your primary care provider or specialist, or using an online resource like smokefree.gov just to learn more about your tobacco use, what the risks are, what the benefits to quitting are. Really getting that information so that you can get to a point to where you're not just wanting to quit, but you feel ready to quit. I often tell patients, it's good to know that you need to quit, to want to quit, but you have to be ready to take that step because, as people say, well, I've tried before, it was tough, right? And I think the more knowledge you have, the better informed you are. Then it helps you to better know how to tackle your care. And I usually always recommend to patients, support systems are key, whether that is a family member or friend or other loved one, whether it's someone going through something similar. Just having a support system can really help you achieve your goals, having a cheerleader in your corner. Um, and then, the last thing I always tell them when they're trying this or trying to quit anything is to set up your environment for success. So you don't want to make those cigarettes easily accessible in your home. If you can get rid of them completely, that's great. If you're not ready to make that commitment, locking them up, making a rule that, hey, we don't smoke within the home or in the car. There's simple things that you can do to try to help make your attempt more successful.
So like even little baby steps here and there, if you're kind of on that teeter-totter thing, if I know I need to quit, but I'm not really ready to do that yet.
Exactly, exactly.
All right, we're going to continue to talk about how do you quit, how we can have resources for you to help you with that. That's coming up right after the break.